So hi everyone, today we're gonna review about these words like fissure, fistula and hemorrhoids, or we can say piles. Okay, so in the very first one we see that in the piles, here in the anal part we see lots of veins are there. So these veins get enlarged, or we can say bulged, when hardened stool passes through this area. Okay, and these bulgings may be inside also and outside also. So if it is inside, we call it internal hemorrhoids, and if it is outside, we call it external hemorrhoids. Now let's talk about fissure. So fissures are generally a cut in these anal parts due to uh, hardened stool. Okay, and when we talk about fistula, so in the fistula, actually the glands are present. Some glands are present here in the rectum part, or we can say in anal part, and these glands secretions cause the moisturing of the stool passing through these parts. Okay, now when these glands get infected, that leads to abscess formations, pus formations, and that pus abscess are further create a passage between internal rectal parts, or we can say anal parts, and outer skin, and these channels we call it a fistula. Okay, so fistula is generally a channel, or we can say chamber, created between inner and outer skin. Okay, inner anal area and outer skin. So let us see here furthermore about the fissure, hemorrhoids and fistula. Okay, now in the about the fissure, we can see here that a fissure is a small tear or cut in the lining of anus. Okay, it can cause pain, bleeding, discomfort during bowel movements. Now the fissures are usually caused by trauma to the anal canal. Now this trauma may occur due to constipations or inflammatory bowel diseases also. Okay, now talking about the symptoms. So of symptoms of the anal fissures includes, of course, it cause pain or after bowel movements. Okay, so the pain may created before or after bowel movements. Right, now bright red color, red is blood on the stool or toilet paper. Now itching and visible tear in the skin around the anus. So the itching can also be caused in this area. Okay, these are symptoms. Now talking about treatments. So treatments for the anal fissures may include dietary change, which is very important. Okay, now fiber supplements, topical ointments are also given. In some case surgery, so in some cases surgeries are also suggested for these patients. Now talking about the hemorrhoids, or we call it piles. Okay, so here we can see in the pile, so hemorrhoids are swollen blood vessels in the rectums or anus. Okay, so these are bulge, or we can say swollen blood vessels. Okay, this can be internal or external, as we discussed earlier. Okay, hemorrhoids can be caused by straining during bowel movements. So it can caused due to straining and due to creating more pressures during a stool passing. Okay, and then chronic constipations or diarrhea. Pregnancy is also cause. Okay, in the pregnancy the uterus size increases, which affect in the stomach also, that lead to different diseases like GERD, Barrett's esophagus. Similarly, these if in the pregnancy conditions the uterus size increases, and that leads to create pressures in lower abdomen also, that is in this anal area, and that leads to bulging out these blood vessels also, and that causing hemorrhoids. Okay, now obesity also creates pressures inside the abdomen, and that lead to create that bulging of the blood vessels in the rectal area. Okay, now sitting for a long period of time, okay, that is also uh, cause for the hemorrhoids. Now talking about the symptoms of hemorrhoids includes rectal bleeding, itching, pain, swelling around the anus, and discomfort. Okay, now talking about the treatment for hemorrhoids may includes lifestyle changes. Okay, such as increasing fiber intake, over-counter creams, suppositories, nearly invasive procedures, or surgery in severe cases. Okay, now let's talk about the fistula. So fistula is an abnormal tunnel-like connections that forms between two organs, or between an organs and the skin. In case of anal fissures, they usually connect anal canals to the skin near the anus. So as we have already discussed about the anal fissures, that it is connections created between the internal anal area and outer skin. Okay, that is due to infections in the uh, glands that are present inside the anus or rectal. Okay, now anal fistulas are often results of an infection in an anal gland that has not healed properly. Now symptoms for the anal fistula includes persistent anal pain, swelling around the anus, discharge of the pus or blood, and recurrent anal abscess. Okay, now treatment for the anal fistulas often involves surgery to remove the fistula tract and promotes proper healing. Okay, so this much for now. Thank you so much for your attention. We will furthermore describe in the depth in the next videos. Okay, separately about the fissure, about the fistula, about the hemorrhoids, their cause, their uh, symptoms, their diagnosis, their treatments, in the separate video. Okay, thank you so much for your attention. Thank you.